Malaria is a very important lecture, and if you don't listen to me carefully today, you will miss because the life cycle is very confusing. If you read it through your book, I'm sure you'll end up getting confused, and you won't remember anything. It's an important chapter. There you get so many you get a long question also. You get many short notes also from this chapter. And the topics of interest, the questions are, it could be the life cycle of malarial parasite. Then pathogenesis is a long question, very, very important, comes many a times. Clinical features, complications. Immunity against malaria can be a short note. Epidemiology usually doesn't come in microbiology, but these days anything can come. Lab diagnosis is extremely important. The last three things are not very important in microbiology, but as I told you, life cycle, then pathogenesis, clinical features, immunity, and lab diagnosis. These five things extremely important, and so much so that clinical features are repeated almost every alternate year only. So the name malaria, the name comes from the name malaria comes from mal air. That's bad air. So initially it was believed that it is spread through this thing by air pollution. Now, of course, we know that this is not the truth. And all of this you've read, I'm sure. So, do you know the contribution of Dr. Ronald Ross in this thing? In malaria, have you heard of it? Anybody? In Hindi, there used to be a chapter in Hindi Patrika. You have not read it at all? Huh? Because I think NCRT books, I'm from Delhi, I'm not from here, so I don't know what happens in Rajasthan, but in Delhi NCRT, but NCRT is the same everywhere. I'm sure you would also have followed NCRT only. था ना एक chapter इस पे? It was there. It used to be there in my time. So Ronald Ross was a surgeon who was posted in Secunderabad. If you are so amused, you can leave. So Ronald Ross was a surgeon who was posted in Secunderabad, India, and during this time, during the stay in India, he made a very important contribution. Why? Because he studied the sexual cycle of the parasite, and for this he was awarded a Nobel Prize also. This is a MCQ also for your this thing, pre-PG. Now, human infection is mostly caused by 5 species. Plasmodium. Can you tell me the species? Number 1. So this time we'll go row wise, 1, 2, and 3, because there are many things which I wanted to remember. So I'll go row wise. So row number 1. Can you name a species? Louder. Plasmodium vivax. Number 2. Can we say the full name, please? Falciparum. Excellent. Third row. Fourth. The full name? Malaria. Do you know a 5th species also? My God, you know it? How do you know it? In NEET, pre-PG, also PMT. Where? PSM. Very nice. So I thought you would not know this. There is a 5th species also which is known as Plasmodium knowlesi, and this is a zoonotic disease. What's a zoonotic disease? That is, yes, it's a disease of the animals, and humans will get infected only through close interactions with animals. So that's Plasmodium knowlesi. So are there any cases being reported in India? What did the PSM people tell you? Anybody? I don't think so. I checked my Google today also. You can also go back and check. Till today, I did not find any case but it is very surprising because the vector is Anopheles leucospirus. This is your pre-PG entrance exam question. So what is the vector? And the largest foci is seen in Malaysia, Thailand, and Singapore. No cases from India so far. And why? Because that we don't know, because the vector is very much found in Kerala and Maharashtra. Yet we have not had a single case. So the exact reason we cannot comment. Now it is important to know why, because it is similar to P. falciparum. So the P. falciparum, okay, tell me one thing. Which is you've named me 5 species. What according to you is the most severe? Do you know the reason? Yes, it causes malignant tertian malaria, but do you know the reason? Why malignant? I'll tell you a few reasons why falciparum causes. In fact, this is your Viva question also. I'll keep on telling you the important topics. Viva question, theory question, pre-PG entrance exam question. I'll keep on telling you so you can mark and you can remember. I can see that none of you have your books open, but you can still jot it down if you are interested. So this also causes a high parasitemia and a severe malaria with many serious side effects. So it's important. We just can't ignore because we don't have these cases in India. Now this is important. It is confusing, and I don't think people understand it very much. And 2 to 3 is not a good time to go through this lecture also. But let's try. I'll make it interesting. So it has two hosts, a definitive host and an intermediate host. So the definitive host, which part of the cycle does it carry on? Sexual. And the intermediate host carries the excellent. So what is the definite? So in most of the infections, you will see that man is the definitive host, but this is an exception. Why? Because man is the intermediate host and harbors the asexual phase of the cycle, or also known as schizogony. Whereas the mosquito, the female Anopheles mosquito, is the definitive host and harbors the sexual phase of the cycle. So the question for you now is row 1. Sexual cycle is known as? It's written there. No, you have to be louder. I can't go on like this. Sporogony. And the asexual cycle is? Schizogony. So humans are the definitive or the intermediate host? Yes. So how does the cycle begin? The female Anopheles mosquito, which is carrying the infective form of the parasite, will bite the human. I can see such sleepy children. It is so bad. I feel so bad giving a lecture at this time. What can I do? Have some water if you are very sleepy. Okay. So, the cycle begins with the bite of the mosquito, and when the mosquito bites, sporozoites are introduced into the bloodstream of the human. Now, then begins the human cycle. So, human cycle has phases. Number 1 phase is? No, see, we have to stay awake. So, you have to speak with me. Number 1? What is erythrocytic? That means it has something to do with RBC. Right? So number 1 is your pre-erythrocytic schizogony. Number 2 is? So pre-erythrocytic means something before the RBC. Hai na? So erythrocytic means in the RBC. And number 3 is? Gametogony. Right, very good. Can we repeat this? Number 1? Because this is the main crux. If you remember this, rest you can fill up in your Viva. And number 2? Number 3? Okay, fine, chalo. And what are the infective forms? And who harbors this sporozoite? The mosquito. And it is present in the salivary gland of the mosquito. So when the mosquito bites, sporozoites are introduced. Now begins the human cycle, as I told you. This is a 4th cycle, which is not a phase in the cycle. I'll explain what it is later on. So let us for now concentrate on the first. Excuse me, madam. You can leave. If I ask you to have water, that doesn't mean you can joke around. Leave if you're not interested. So we'll talk about the pre-erythrocytic schizogony. Now, which organ system do you think it involves? Yes. So your sporozoites, once the human gets infected by sporozoites, they immediately enter into the liver, and the liver, they undergo their developmental phase. Can I ask some of you to read? That will keep all of you awake. Hai? So, 3rd row, can you get up and read? 1 line each only I'll ask you to read. Very nice. Next boy. Please sit.
Sporozoites are elongated and spindle-shaped, become rounded inside the liver parenchyma.
Very nice.
Size of contain 20,000 to 50,000 units. On maturation, liver cell structures and different
Merozoites into the bloodstream. So you understand, sporozoites, they enter the liver, and in the liver they undergo a developmental phase. They form sporozoites. They form what? Schizon, and schizons they again divide to form merozoites. And when these merozoites are large in number, they will just go into the bloodstream. So this finishes your first phase. What was your first phase? So when they mature, 3rd boy. So when they mature, what form gets released into the bloodstream? Merozoites are released into the bloodstream. So what is the second phase now? Very nice. So this if you want, you can remember the important thing in this is the duration of the pre-erythrocytic schizophrenia. This is your pre-PG MCQ question. Like when I was a student, I remember it as 6, 8, 9, 14. And this thing has stuck with me. So you also develop your own ways of learning because it's an important MCQ question. 6, 8, 9, and 14. Now, I told you that there's a last cycle. What was the last number 4 cycle there? Exo. So I told you that it is not a part of the life cycle, but what happens is when these merozoites they get released, they go and enter the bloodstream, right? So some of the merozoites they do not go to the bloodstream, they decide to sleep. Like I tell you, last row people come in the front, and you're so reluctant to come, so they are also like you. You know, they're very reluctant to leave the liver. They're very happy and secure in the liver. They stay there only. So what happens? Now they're lying dormant, they're sleeping like backbenchers, they prefer to sleep, but unfortunately I don't let you sleep at all. So what happens is the person might appear normal, might get cured, but later on these hypnozoids they are known as hypnozoids. They sleep, they're dormant form. So later on these can somehow activate again and can cause malaria. So this is known as your what? Relapse. For that you have to remember exoerythrocytic, otherwise nothing else. So, and this happens only in Plasmodium vivax and ovale infections, never in falciparum. Clear? So, patients having recovered from the first episode of illness may have several recurrent episodes. Why? Because the dormant liver stage parasites, they may reactivate. Now, my question, what are the dormant liver stage parasites known as? Louder? This slide will do later. This is an important slide. So what was the second phase of the cycle? Row 2? Very good. So who will start reading now? The first row only I have to bother because they are so reluctant to come in the front. Yes, you have to get up. Don't smile. So finally you decide to take off your mask. Chalo. Yes, next. So you know, Plasmodium parasite also has a predilection. Like Vivax will infect only the get up. You have to get up and leave. Get up and leave. Second row, third girl. Yes. Sorry, you have to leave. So Vivax infects the young erythrocytes and malaria infects the. You have to leave, madam. I won't continue. I told you I won't take indiscipline. Whether it's a boy or a girl, leave. And malaria infects only the old erythrocytes. But P. falciparum, you know, this may be one of the reasons why falciparum infections are more severe. Why? Because P. falciparum can infect all the RBCs of all ages. And the last line we'll read later. तो इसको भी रहने देते हैं. This duration of the erythrocytic schizogony, it differs in various parasites. So it is 48 hours in falciparum, vivax and ovale. So ovale you don't have to bother. Sometimes if you're near viva, you're asked what are the various species of Plasmodium that you know of. Please do not start with ovale. Why? Because ovale cases are not even seen in India. Start with falciparum and vivax. Clear? So both falciparum and vivax, they have this erythrocytic schizogony duration 48 hours. So that means your fever will appear after every alternate day because the cycle is 48 hours. You understand? Whereas malaria, the cycle is 72 hours. So third day the fever will happen in malaria. So why do you think the patient has fever? Second last row, second girl. I'll give you a chance also. Yes. Why is there a fever in malaria patient? RBC is ruptured, then what comes out from RBC? Very good. So every time RBC rupture and there is a fresh bout of merozoites into the bloodstream, the patient has fever. Good. So what does benign, now this is also important for you, it can come as an MCQ. So P. vivax causes what? Number row 1? Benign tertian malaria. P. falciparum row 2? So it's the same, the cycle is 48 hours only, but it is malignant because more severe. Malaria cause what? Cotton malaria, because every 72 hours. And oval? Okay. Now, RBC, now we're talking about the erythrocytic cycle. So, in the RBC, you can remember TSM. I remember it as TSM. T stands for tropho, S for, and M for. So, this is a cycle, first trophozoite, then S and M. And every time they rupture, merozoites come out, there's a fever. Now, this is what a trophozoite looks like. After invasion, it grows and feeds on hemoglobin into the RBC and it forms a ring like structure. Can you see this? So, this is a trophozoite and schizont is a circular structure. So, remember this because in your practical exam, in your spots, we generally keep a card and this is put and you are asked to identify it. So this is the trophozoite stage of the malarial parasite. And what stage is it? It could be any. At this point, you cannot differentiate which parasite it is. And schizont, then it becomes compact. Now this is important. You have to remember this. In P. falciparum, I was telling you why it causes severe infection. Can you stand up and read? Yes, you.
Plasmodium falciparum infected with two sites with cyanodes aggregating the capillaries of veins and other internal organs.
बैज होता क्या है कि जिन आरबीसीज के अंदर पी फैल्सीपेरम का पैरासाइट है दे हैव दिस स्ट्रेंज टेंडेंसी दे टेंड टू अडहेयर एंड सीक्वेस्टर they the vital internal organs, your brain, your kidney, your liver. So what happens is they go into the capillaries and get stuck there. So when they get stuck there, blood flow is restricted and this leads to ischemia and necrosis. That is why there is more severe infection with Plasmodium falciparum. This you have to remember. It's a viva question. And since most of the forms are stuck into the internal capillaries of internal organs, what form will you see in the blood smear? Only the initial form, that is the ring form of the parasite. Yes, the trophozoite form, very right. Because as soon as they start to develop, they don't leave the internal organs. They don't come to the bloodstream. And that is why it is the internal organ that bears the brunt in a P. falciparum infection. Now you can read this and you have to remember it. But you won't be able to remember it. That is also a surety because even I have to prepare this every time I come here for a lecture. I also have to study it. But basic difference is what you can remember is that the Schaffner's dots. So your MCQ will be like the underlying these are common for P. vivax except. So these features are common for P. falciparum except. So this much you should know. Like in P. vivax, the RBC is enlarged, Schaffner's dots are present, and the schizont is, the RBC is enlarged and the schizont fills the RBC. Can you see that diagram? I don't know how much you are understanding it, but the RBC, the infected RBC is bigger than the other RBCs. Can you appreciate that much? And it is filled with schizont. The schizont is filling it entirely. P. falciparum, the RBC is normal size as you can see, and there are multiple ring forms are seen. And sometimes these ring forms they get attached to the surface of the RBC and it is known as ecole form. So the MCQ is ecole forms are seen in which infection? Malaria and oval we won't discuss in it. At least remember vivax and falciparum. Yes. So what all phases have we discussed? Number 1 was pre-erythrocytic schizogony. Number 2? Okay. erythrocytic schizogony नहीं बोलना है क्या? प्री के बाद तो erythrocytic आएगा ना, उसके बाद ही तो आएगा ना वो exoerythrocyte. So pre-erythrocytic, then erythrocytic, and then exo means what? Those parasites that have decided to lie dormant. What were they known as? Second row, third girl, get up. Yes, read. So every time I see somebody yawning, I ask that person to get up. No, read only one line each. I only have to disturb you from your sleep. Next girl. Some sporozoites do not undergo sporogony in the first. Yes. Next, you have to stand up on your own. Hmm. So first row, second boy.
Within 2 years, reactivate to form chromosomes, release merozoites, and attack red cell and produce relapses.
So now everybody looks awake. So second last row, third boy. Yes, you. Last line. So this you have to remember that in Plasmodium falciparum infection there is no exoerythrocytic phase. There are no hypnozoites, so the patient will not have a relapse. Am I clear? And relapse I have already told you. Now next third phase was gametogony. What is gametogony? Now the parasite has to undergo development because it has to enter the sexual cycle in the mosquito. So gametocytes are formed. RBCs when they ruptured, what was liberated? So merozoites will now get transformed into a gametocyte. They differentiate into male and female gametocyte. Last row, can you please stand up and read? One line each. Yes.
Macrogametocyte, also called female gametocyte.
Yes. Hmm. 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 But the macrogametocytes are larger in size. Yes. Which form was specifically seen in P. falciparum? Ecole. What was the spelling? ACCOLE. And what forms are seen in the peripheral blood smear in P. falciparum? हाँ हाँ बोल बोल. You were right, I think. Tell me. Which forms, which are the only forms seen in a peripheral blood smear in P. falciparum infection? Ring form, the early trophozoite. So if you see a schizont in your blood smear, you know that this can't be falciparum. And this is what a gametocyte will look like. And now when the gametocytes are matured, the female mosquito will come and now she'll bite and pick up these micro and the macro gametocyte, and they will get transformed into gametocyte, gamete in the female Anopheles mosquito. So the mosquito is what, sexual or asexual? So it is known as definitive or intermediate host. Sit properly. Sit properly. ये कोई पार्क है क्या? So your sexual cycle will be initiated in the humans by the formation of gametocytes, and they develop further in the female Anopheles mosquito. Only the mature sexual forms are capable of further development in the mosquito, and one microgametocyte can lead to 4 to 8 microgametes, whereas macrogametocyte one leads to one only. These are minor issues. You don't have to remember them. Important is that the female mosquito harbors the sexual phase of the cycle and is the definitive host. Now, fertilization occurs when a microgametocyte penetrates into macrogametocyte, and this fertilized product is known as zygote, and it matures into ookinete and then to oocyst. Oocyst will then develop into sporozoites, and where will the sporozoites go in the mosquito? Yes, salivary glands, because she has to do one very important function. She has to bite you while you're asleep. So when she bites you, what form will be introduced into you? Sporozoites. And where will they enter first, the sporozoites? And what is that phase of cycle known as? Excellent. I can see everybody is attentive today. Chalo. So we have covered a very important part of the lecture. One thing that I think I didn't specify, yes, this is a very important slide. Now, falciparum malaria is known as malignant tertian malaria. It's a very serious malaria. Why is it serious? I told you, because it has a tendency to. These are the reasons, right? First row, first girl, can you read?
Sequestration of the parasite. P. falciparum has the ability to sequester the parasite in the blood vessels of deep visceral organs. Leads to blockage of vessels, congestion, and hypoxia of internal organs. This mediated by
Better, better. These are important. Now, Viva may, if you see these, say these three things, na, the teacher will be very happy. They will know that you have read it. Yes, second row, second girl, get up, read. So, number one is your cytoadherence. Number two is rosetting. Rosetting means they bind, to infected to uninfected. Number three, deformability. The parasitized RBCs are more spherical. Just remember cytoadherence and rosetting, extremely important. So what happens is they get captured. They are stuck into the in deep organs, your brain and kidney, and the parasite can't come out. And there is hypoxia and there is brain damage. Now pathogenesis and clinical feature. I think 5 more minutes will take. So benign malaria, it is milder. Let's not talk about febrile paroxysm. So what leads to febrile paroxysm? Every time the RBC ruptures, merozoites are released. There is fever. So if you have to prepare a blood smear, yes, you get up. If you have to, how do you diagnose malaria? क्या phases से 3 साइकिल के लाइफ साइकिल के? ठीक है, बैठ जाओ, कोई बात नहीं. ठीक है. So every paroxysm of fever is comprised of 3 stages: cold stage, hot stage, and sweating stage. This fever of malaria is very different kind of fever. There is always this. The first, the patient feels very cold and there is chills, and the patient has high fever. That is known as the hot stage, and then the fever suddenly comes down with lot of sweating. Typical, if you're sitting in the medicine OPD or you're doing some camp in some periphery and your patient tells you this कि बहुत जाड़ा लग के मेरे को ठंड लगती है, फिर खूब ताप रहता है और फिर उतरते समय there's a lot of sweating, you can be very easily sure that it is malaria. So what is the first diagnostic test that you would do, which you can even do in your peripheries? Peripheral blood film you will do. Then, since so many RBCs are getting destroyed, it will lead to anemia. And since so many RBCs are destroyed and removed, it will lead to splenomegaly. Now, this I have already told you. Now, for students who are wanting to get that D Viva kind of students, the last line you can go through that, last line. So, there is this particular antigen, this gene, that leads to this special capability in P. falciparum. And this undergoes frequent antigenic variation. So every time the parasite comes, it has a different antigen, and that is why the immune mechanism of the human cannot cope up with it, and the infection is so severe. So that is P. falciparum, erythrocyte membrane protein 1. If you are targeting very high marks. Now complications of malaria, number 1 is cerebral malaria. Can we all say it together? Number 1? Number 2? See, pernicious means very severe malaria. So, cerebral malaria is a short note. Pernicious malaria is a short note. Black water fever, algid malaria, septicemic malaria, they're all short notes. And long question is complications of falciparum malaria. So, everything is important in these slides. I think this we can cover in next slide also. One more, and I just want to revise it once. If you remember this, then I will be happy. So definitive host is? And intermediate host is? Asexual cycle known as? Asexual is schizogony. Sexual cycle is? Very good. Human cycle has what phases? Number 1? Erythrocytic and gametogony. Gametogony leads to production of what? Gametocyte. Gametocyte is picked up by what? And then gametocyte forms what? There will be fertilization leading to what? What were the dormant forms known as? In P. falciparum, only one form is seen in erythrocytes. What is that? Only ring form. What happens to the other forms? What were the 3 developmental phases in erythrocytic schizogony? I told you TSM. T for? S for? M for? Yes. So in all other parasites, you will see all the 3 forms: trophozoite, schizont, and merozoite. But in P. falciparum, you will see only the trophozoite. That is the ring form. Very important question. Viva, MCQ, everywhere. Clear? So this is the summary, and remember this.